like to introduce you to our dentist, Raeesa Parker. Why don't you start off by telling us a little bit about yourself?
So I'm a general dentist. I'm in private practice, which caters to families for the most part. And I also work at the University of the Western Cape in the Department of Pediatric Dentistry, where I do clinical teaching with the undergraduate students. So between those two platforms, I've got quite a bit of experience dealing with children. And also dealing with parents, and so I think I have quite a bit of understanding as to what parents are concerned about. And there are common questions that tend to crop up in the conversations that we have at the first visit and subsequent to that.
Okay, yeah. So why don't you tell us a little bit about something that you've included in the guide?
Sure. So what I think tends to surprise a lot of parents is the recommendation as to when you should bring your kid in for that first dental visit.
Yeah.
So it's actually advised that you bring them in within 6 months of the first tooth erupting. So for most kids that puts them at the 1-year mark, right? What we tend to find though is that parents will bring their kids in a little bit later when they present with a problem. So maybe there's a visible cavity, sometimes on the front teeth. Or there's pain. So we talk about why that first visit is so important, even though at that point there's only maybe 1 or 2 teeth in the mouth. And then also how often after that you should be bringing them in, and what we more or less will discuss within that first visit.
Yeah. So that's something that I was one of the people very surprised.
Yeah. So long as you're bringing your kid in, even if they pass that point, bring them in regardless of whether you think there's a problem or not. We can get them used to the setting, get them used to the chair, get them used to someone having a look in their mouth. It can be very overwhelming, when you walk into this room and there's a lot of different sounds, and someone's kind of poking around in your mouth, and there's lots of instruments, and it can be an overload for kids. So when you bring them in for the first visit and there's nothing that specifically needs to be done, then it allows us to ease them into it.
Yeah, and so it's not traumatic for parent and child.
Exactly.
And dentist.
Well, yeah, exactly. Thanks for thinking about us.
Is there anything else that you want to add that you think that parents might enjoy in terms of what you've included in the guide?
So we've touched a bit on fluorides, which is it's a hot topic, parents, or not just parents, people in general have ideas on fluoride and whether it's good, whether it's not good. So we do talk about that and its role in preventing decay and how we can safely use it. We talk about pacifiers or dummies. What are the different types? When is it appropriate for your child to be using it? And at what age should you be weaning them off of the pacifier? And then we also talk about finger or digit sucking. Okay, and this is a habit that a lot of children tend to have. So how can we manage that habit, so that it doesn't have any long-term effects on your child? Essentially, we've tried to distill all the important information into this guide. I think it's a nice way for parents to navigate whatever anxieties they may have, and also for them to learn a little bit extra. Whatever's in the guide, you can even apply to your kids who are older than 3 years old, and even to yourself from a dental perspective, definitely.
Yeah.
So, yeah.
Yeah, I think I've really enjoyed the information that you've put in the guide, so I think parents will definitely learn from that. Thank you so much.
It's a pleasure.